Good evening, all. We will have so many free classes from Joshi's Kerala group. Today, our Baswara sir is with us. We all know that he's the person who developed the Nadiswara, the wonderful, the magical instrument. By using this Nadiswara instrument, you will get a scan report. With the report, you can predict the present and future condition of a person, the health condition. To hear more from this
last week we were discussing about how Nadiswara patterns
I'm inviting Baswara sir to this platform.
People. We'll continue that. So position of Nadiswara is very important. You should keep Nadiswara exactly perpendicular to the radial artery so that you won't feel the loss of data, because the right input to the system always gives the correct output. If the angle of sensor is not correct, and if you are not wearing the right pressure, both will end up with the wrong output. So that's what, keep it perpendicularly on the radial artery where you are sensing maximum pulse. And second important thing, you have to vary the pressure where you can get the maximum sensation. The moment you start taking the pulse, somewhere you feel the noisy, somewhere you feel very low pulse. You avoid those things. Take the pulse where it's a maximum amplitude and clear pattern will be there. And that pattern should repetitive continuously in the same way for 20 seconds. So then only, then you go to the analysis, then you'll get the right output. If you are not keeping sensor in the proper angle, and if you are not varying the pressure to get the maximum intensity signals, both are ending up with the wrong output. So you come to know by taking a few pulses. So for this, we have some videos that we can share to you. It's already there in the YouTube Nadiswara channel. Just please go through that so that you can understand better. Next, come to the report reading. Whenever you take pulse, give more importance to the first two highest elements. Anything, the first two highest, maybe 3 are higher than 0.15, or maybe 3 will be there, 4 will be there, or 2 will be there. But finally, we are giving importance to the first two highest elements. In that, first highest representing the meridian, and second highest, which is representing the energy. So here, the more importance among two is second one only, because the primary one which you are just denoting meridian itself. The second thing, the energy. So what is the energy of air? The air element or metal element? It's a dryness. So dryness means which organs? lungs and large intestine. Correct, no? Many of you are getting problems. Someone is texting Surender Arora. So you have same humidity and dry. So can you raise your hand? Just unmute. Surender, are you there?
Not seen in the list, sir. He's not there.
Anybody having this pattern? Shirish. Yes, Shirish Kumar.
Sir, my patient is report this.
Can you show that?
Yeah, sir.
Yeah, exactly. All 1 minute, I will make everyone, they can see this.
Yes, sir.
Just keep it that. Everyone seeing this is pattern. Primary is earth. The secondary is air. The third is coldness. Thank you, Shirish.
Yes.
So everyone seen that. So now I'm not seen Shirish,
Yeah.
but through pattern, I know everything about him. Is it visible, Surendra, the pattern which is showing? Yes, for everything is visible. Thank you, sir.
Yes.
Now we will discuss. I'm audible to you, Shirish?
Yes, sir.
Hi.
Yes.
Your voice is not audible.
Not audible, sir. Sir, my voice is not audible.
Your voice is very...
You're audible to us. I don't know. Sir got some problem. When I give the announcement, sir didn't hear that.
We hear both.
Is
Okay,
it?
I am not hearing his voice. I'll just check. And now? I'm sorry. Yes, Shirish. Hi.
Yes. Yes, sir.
So, just knowing pattern is enough about the patient. Nothing else is required. Because it is telling what you are right now. I'm not talking about your body constitution or prakriti. I'm talking about the present constitution of your body. Your primary is humidity. Means the imbalance is there in the spleen and stomach. Means in a digestive system. In digestion system, you know that there's a 5 elements are there, which is governing your this one. For example, the momentum of the food is controlled by wind. Fine. And digestion is controlled by fire. And the elimination of that is controlled by dryness. And the rejuvenation energy, the the relaxation and rejuvenation and reproduction of the digestive cells is governed by coldness. So your pattern is, if along with humidity, it's a dry cold is there. Okay. Are you TM students, sir?
Yes, sir.
So dry and cold, yin or yang?
Sir, me?
Yeah, I'm asking you the dryness
Yeah.
and or yin elements or yang elements.
In elements.
So it's yin elements. So in your digestion system, dry cold is there means that is indicating in the digestion system, the yin is more.
Yeah.
And yang is less. Okay. So in one word, yang is less, the function of digestion system is less.
Yeah.
But the nourishment is there. In the sense, there is no blood deficiency in the body, and there is no lean body, and there is no deficiency of the food and all. So your blood is there, nourishment is there, and stability is there. But the lack of energy in the digestion system is yang. The yang is not there. So you can show the report so that I can. It is there, no?
Yeah.
Yeah, fine. I think same pattern which is there here.
Yes, sir.
Yeah, coolness is also a little more.
Sir, she has eczema and some period issue.
What is the age of the patient?
44.
44. So fine. So here the symptoms may be eczema, PCOD, whatever it is. All the symptoms, known and unknown, the symptoms which is related to the yang is less, the yin is more. The period is not happening because to make it menses, the body requires momentum.
Yes.
That momentum is not there. Due to that lack of momentum, lack of yang energy, it is delaying.
Yes, sir.
So it is delaying means maybe 3 months, 6 months once.
Yes.
If the same pattern, instead of dry cold, if the heat is more, the early period happens because of the excess momentum, excess yang energy. They will get menses maybe within 20-25 days.
Yes, sir. Irregular. Yes.
Okay. So here in the digestion system, the yang is deficient. Why period is irregular means to the digestive system, it's controlled by kidney and urinary bladder. Those organ is again controlled by spleen and stomach. In the spleen and stomach, if the yang is less, this is a situation, spleen yang deficiency or spleen chi deficiency. She is in between. If humidity dry is there, spleen, dryness means it's a lungs. Lungs means what is doing lungs? What is the job of the lungs? It is generating the chi. The dryness means lungs and large intestine, which is responsible for producing prana shakti in the body. So here it is indicating humidity means spleen and stomach. In that dryness means dryness is indicating chi deficiency. With anybody, if cold and dry is there, means kidney chi deficiency. Heat and dry is there means heart chi deficiency. If the wind and dry is there means then it is liver is not producing chi, but it is liver is circulating chi. Wind and dry is the liver chi stagnation. Okay. So finally, if the dryness is rising in the pulse pattern means there is a chi deficiency. Along with dryness, if cold also rising up, the cold is an extreme yin. Where there is a cold, there is a deficiency of yin and yang. So, humid, dry, cold is indicating right now she is in spleen chi deficiency. From that, the the disease is progressing towards spleen yang deficiency. It's little chronic. Spleen Qi deficiency, it is a little acute compared to the spleen yang deficiency. Because spleen Qi deficiency, it is only the momentum of the Qi is low. It may create food stagnation, indigestion, constipation, obesity. Those things will be there.
All will be.
All are there with.
Yes, sir.
Yes. But when spleen Qi deficiency is there, don't worry much. It is easy to solve. And easy means it will take minimum 2 to 3 months. But humidity cold is there. That cold is indicating the yang deficiency. Spleen yang deficiency means the digestive function itself is going down. So that takes more than 6 months to solve. But it is solvable. And I'm not telling it is not solvable. It's solvable, but humidity cold means spleen yang deficiency. You have to regenerate the function of the organ. Definitely it takes minimum 6 months. But it happens. But humidity dry is there now. It's just Qi is deficient in the body. That you can solve in 1.5 to 2 months. The spleen, humidity and cold normally we see in the diabetes patients. In those patients, they are unable to convert their glucose, the rice, wheat, ragi, jowar, what you are eating. Your body is unable to convert into body eatable way, means glucose, fructose. So your carbohydrate has to convert into glucose. Who is doing that job? That is, job is done by spleen yang. That is, job is done by spleen yang. If that spleen yang is deficient, means your food is not converting into glucose. If it is not properly converting, then body won't absorb properly. The left out is residing in the blood. So for this patient, I'm not telling she's diabetic, but if she's not solving this spleen Qi deficiency along with the towards yang deficiency, future may that weakness of digestion system, the near future, that makes into a blood sugar variation. So Nadiswara, you don't see as a only diagnosis device and it is solving, giving 1 point. It is giving wonderfully giving 1 point solution and also diagnosing the present condition. But look at the Nadiswara as a predictive device. How can predict the health of the patient in another 6 months and another 1 year? How they are? So I'm telling you how they are made. If you are not treating this, the digestive goes down day by day, day by day. So when digestion is not happening properly, elimination won't happen. They end up with the constipation. If the food is not digesting properly, the undigested food accumulates in the adipose tissues and increase the obesity. Because your food is not converting into glucose and energy, obviously patient feels lethargy, tiredness.
Also, sir, depression disease.
Yeah, exactly. I'm going to tell next that one only. She's feeling tired now?
Yes, sir.
Your bodily, your tired means the same glucose is not available for the mind also.
Yes, sir.
To the mind, the fire is not reaching. So, mood is low. Low in the sense, oh, let it go, and it is not possible. So, I am loser. Like that, the low emotions will occur. So, the fear of getting into the losing something.
Yes, sir.
So, if you go to the doctors, PCOD, they'll give one medicine,
Different.
other medicine. For the nutritional deficiency, they will give you multivitamin and some syrup. And for because yang is not there, skin elimination won't happen. If elimination won't happen means the unwanted things will scale on the skin.
Eczema there.
Eczema will be there, or psoriasis, or they may have some black scale on the skin.
Yes, sir.
All these, it's a yang deficiency. Your food is not metabolizing. You no need to go to the skin specialist. It's a waste of money and time. Have you visited doctor already?
No, sir.
No. If you go also, they will give you some creams, some ointments, whatever they give, that works on the skin. But problem is not there in the skin. Problem is not there in the gynec system. Problem is not there in the mind to visit the psychologist. The main problem is your digestive weakness. So I will give you very clear roadmap to this patient.
Sir, one thing I want to say, sir, what use these points?
I will just wait, sir. I will check. I will come back here. Now you show, sir.
Yes.
So these are points. Come little near. Have you seen the points? The red marks which are glowing in the lungs, liver, stomach, and thoracic 4 and thoracic 8. Thank you, sir. Means for this patient, spleen, lungs are weak. That's what they're unable to produce the chi, and they're unable to metabolize the food. So all of you know that your entire body is reflexing. Where? Wherever you want. Your body reflex, you can consider this. This is head, this is tail. And you can Sudoku like this. This is your head, this is your body, and these two are legs.
Yes, sir.
If you want to consider the ear also. In the
Yes,
ear,
sir.
this is
Yes,
your
sir.
head, this is your neck, this is your lumbar. So it's the inverted shape of your fetus inside the uterus. Got it?
Yes,
So
sir.
now you want to take your face as a reflex, take it. This is head, this is anus.
Yes, sir.
If you want to take this hand as a reflex, take it. This is head, this is trunk, this is lower body.
Yes.
This is called reflexology. The Parjot is head, this is leg. And Devendra Vora told this is head, this is the lungs, and this is urinary bladder. Whether you are following Devendra Vora, Sujok, or any other reflex method, I'm telling you with my 15 years of experience, all are working. Don't tell acupressure won't work, Sujok won't work, this will work, that won't work. No. All are working wonderfully, superbly. No doubt in that. If anybody of you having urine inconsistency, just press this point. Just press this point. Urine urgency, urine inconsistency, frequent urination, unable to urination, slow urination. For all problems, just daily you press this point for half a minute. You can see the wonderful improvement every week. You can ask next question. Sir, in Sujok it is stomach point, na sir? Yes. In Vora, it is a bladder point. In some other method, they may something. But all are working unitedly. Do you know? To make immediate urination, which energy you require? It's a stomach. Stomach, all of you know that TM students, stomach energy, it's always pushing food downward. Stomach energy is always moving downward. So if you want to make urination without a delay, without disturbance, without pain, Not that energy comes from the stomach. So that's what many urinary disorder problems is solved with by treating the stomach. So that's what in Sujoka it is stomach. In Devendravara is urinary bladder. I'm telling you, press this point, it works for urinary bladder as well as stomach. If stomach heat is more, you'll get frequent urination. Yes or no? That too, in more urination also two types. If you are going multiple frequent urination with a small quantity, that is stomach coldness is more. If you are going frequent urination with more quantity, with slight yellowish in nature, that is stomach heat. The treating points are completely different. Frequent urination with low volume, we sedate SP9. Because it's a yang deficiency. Frequent urination is slight yellowish with more quantity, it's a stomach heat. Then we sedate L11. So that's what in always keenly you should observe. Nadiswara is giving you the roadmap. Where is the problem? How can you use your Nadiswara best way means? You can use Nadiswara best way by attending TM classes. Because in TM we are telling in depth how stomach is responsible for urination, responsible for elimination, responsible for lower abdomen issues, and responsible for digestion, skin, responsible for vision, responsible for breathing. That's what in recent days we are not giving Nadiswara who are not attended for TM courses. The reason is very simple. If you don't know how to analyze to the patient, then you can't use Nadiswara. You won't use. If you are not using Nadiswara means it's not benefits for you and as well as for me. Everything should be alignable. What Shirish told, no, this pattern. I'm telling you, Shirish, for this patient, you should follow the food very strictly.
Yes, sir. Yes, sir.
I'm telling you, another 3 months, minimum 3 months.
Yes, sir.
Should not touch any food which makes stomach cold.
Okay.
Because already stomach is cold. If you give dairy products, sweets, fruits, and raw vegetable, all these things, they makes further stomach cold. If stomach cold is there means yang goes down, function goes down, again
Yes.
food won't digest properly, again weight gain happens, PCOD happens. I'm telling you,
Yes, sir.
giving pint only is not important. You follow my instructions just 2 to 3 months and you share your experience in the same group.
Yes, sir. Sure.
Okay. So right now we have to raise the function of the digestion. So today morning around 8:30, tomorrow morning 8:30, you give SP9 sedation.
Sir, Nadiswara is something changed.
It is giving,
ST42, sir.
that's what. Nadiswara for single pattern, it is giving 4-5 points.
Yes, sir.
Changes every time, you follow that.
Okay, sir.
Right now, you can touch SP42, that also works.
Okay, sir.
Or else, you can sedate SP9 tomorrow morning 8:30, because from 9 o'clock to 11 o'clock is the spleen time.
Okay, sir.
Do that, and daily without fail between 9 a.m. to 11 a.m. should not drink anything, should not eat anything.
Yes, sir.
Because 9 to 11 is a spleen. Already our spleen is cold, damp. If you give any food or if you give any drink, even
Yeah.
water, that further makes spleen wet. Stop that. And second, strictly say no to sweet. It may be sugar, jaggery, honey, natural, unnatural, organic, doesn't matter.
Yes.
To our tongue, okay, you should not feel sweet taste for another 3 months.
Bitter taste. She is bitter taste.
Right now, bitter is there. But
Yeah.
in another 3 months, she should not feel that sweet taste. Okay. Upon that, always give some hot soups by adding little pepper and ginger in the food in small quantity, in minute quantity. And daily once or 2 days once, as shown in the Nadiswara, apply seeds. Reflex point. To the meridian, you have to apply only once in a week or twice in a week. Once in a week or once in a 15 days.
Sir, this.
Yeah, those points. In these points are there, no?
Yeah.
So, hold that, I'm telling you. Here, the points which is blinking in the lungs and liver and stomach, thoracic 4 and thoracic 8, 9. In this position, you have to apply the lungs and stomach, you apply pepper.
Okay.
In the spinal reflex, you apply green gram.
Yes, sir.
Why? Because by applying pepper on the lungs and the stomach point, it is raising the yang energy and improving the digestive function. And as well as it is increasing the chi energy in the body. And
Yes.
thoracic 4 and thoracic 8 we are doing because they are the spinal reflexology point for lungs and stomach, spleen.
Yeah.
So this you can do either daily or 2 days, 3 days once also fine. Okay.
Yes.
So just do this and you can see the improvement every week. Every week you can see the changes and improvement.
Yes, sir.
Food is very, very important. Upon that, if you want to give any herbal medicine which is rising your yang energy, like some of the herbal medicines that makes body warm and strengthens the uterus, like you can say Ashokarishta in Ayurveda. So that will help you for her to warm the digestion and gynaec one, and she may get menses within one and a half month properly. And you know other medicines like homeopathy, electro-homeopathy, where you can strengthen spleen and stomach, you can give that. Got it?
सर क्या इस सॉफ्टवेयर में ये मेंशन नहीं हो सकता कि इसमें क्या सीड लगाया जाए?
It is just generally given, you can use the seeds, but you decide. If you want to tonify, apply pepper. If you want to sedate, apply methi.
Okay.
Okay, fine. So in the upcoming version, we are planning in different way. In present one, you can use this pepper or methi, you can apply that. Okay. Or if you are in confusion, neutral is green gram.
Okay.
You can do that. So any questions regarding this pattern?
Sir, this pattern, sir?
So, that also. These seeds which you are applying now, you can keep it for 2 hours. Okay, 2 to 3 hours you can keep. One more thing I'm checking. Just show again.
Yes.
To the same report, you are also getting some acupressure points. Okay, So these are all the acupressure points which is showing to strengthen lungs, spleen, and kidney. So where problem is lying, because why it is showing kidney means the third element is coldness is there, na, for her.
Yes, sir.
Why it is showing spleen point here means because humidity. Why it is showing lung point? Because the second element is dryness. Why it is showing kidney points means the third element is kidney. So all these points daily once or twice, each point around 20 seconds you can press. Just like this you can press and leave. 20 to 30 seconds you can press. Okay. And you go back to the diet chart, which is given Vata Pitta Kapha. You go to the third page.
Yes.
Yeah. So here in our body, the humidity is more. So kapha is more. So what is our weight right now?
Around, sir, 65.
65 kgs. Okay. So in that kapha pattern, you just show that pattern. In that pattern, go down. There is a food which you can restrict. Food chart. Just go scroll down.
Yes, yes.
You just enlarge that kapha one.
Okay.
So we given the food chart for Vata Pitta Kapha. So which energy is more? Kapha is more for her, no? So
Yes,
she can
sir.
avoid all the sweets, milk products, and oily, greasy food and root vegetables and some fruits. This already I told. So this will be there in the, already it will be there in the,
Yes, sir.
yeah, it is there in the report. You can follow that. Okay, fine.
Yes.
So any questions regarding this pattern and this patient? Any Sirish?
Yes, sir.
Any doubt?
Sir, she has stuck mind, not following any suggestion, not following any.
Say, earth, what is the nature of earth? Stubbornness, no?
Stubborn. Yes, sir.
It won't bend easily. Okay.
Yes, sir.
Read this and follow this. Even mind level also, she is very flexible and very easy.
She is my patient, sir.
Treat. Okay.
Yeah.
Hopefully, they will heal.
Sure, sir.
Thank you.
Thank you, sir.
So, it's clear for you? Any doubts? The which we explained about spleen Qi deficiency and spleen Yang deficiency.
Excuse me, sir.
So all these symptoms are present in the patient. I'm asking, Shirish Kumar.
Sir? Yes, sir.
Most of the symptoms which is given here, which is matching to patient.
Yes, sir. Poor appetite is there, tiredness is there, or weakness also, pale tongue also, and abdominal distance.
So all are there means your Nadiswara is matching 100% to that
Sir,
patient.
100%, sir, perfect.
Just follow which we told, and definitely within 3 to 4 months she will be superb. Okay, thank you.
Thank you, sir.
Yes, any other doubt?
Yes, sir. Excuse me, sir. Here,
Yeah.
Miran Mohsin.
Yeah, tell me.
The same pattern. What I understood is this is the dryness which makes the stomach dry. So the stomach makes stomach get heat. So we have to. What I understand is so when stomach affected by heat, the stomach in goes down. So we have to tonify the in to the stomach. That is what I understood when the dryness element is coming as a second element with whichever organ. Am I wrong?
No, here dryness is not yang element, it's a yin element. Dryness is a yin, not yang.
Okay.
And the second thing, dryness means which is representing your lungs and large intestine energy, and that is responsible for producing chi energy. Okay. In any element, second element dry, it is indicating Chi deficiency.
Okay.
You can compare with any number of patient. Definitely, as Shirish told, no, 100% matches. One patient last week I treated, is a 26 years old guy, came to clinic by complaining of blood pressure 170 by 110. Even after taking medicine, it is not coming down. The moment I took Nadiswara, that is the primary element is fire and secondary element is air. So what it means? In the art, there is no heat or dry. In the art, the chi is deficient. Due to chi deficiency, heart is unable to function properly. Due to that, the blood sugar is rising up. Because heart is struggling, putting extra effort to do this job. Anybody getting heat dry image is indicating hot chi deficiency. Clear, Niran?
Yes, sir.
You understood the importance of dryness in the body.
Yes, sir. So it means that we have to raise yang.
Yeah, exactly.
Okay. So in chi is another, in another way, it's called as an energy or blood sugar.
Chi is the energy, that's it.
Energy. So functioning energy.
Yes.
Okay.
Okay.
Okay, sir. Thank you.
If anybody having this pattern, it is a deficiency. The digestive deficiency. Okay. Circulation deficiency will be, mind will be low. Even the muscle quality goes down. All these things is a spleen chi deficiency. If you are not treating this spleen chi deficiency, I am telling you very clearly, in another 6 months to 1 year, along with dryness, coldness will rise. Look at it, Shirish. Now, the coldness is third element, no, for your patient. If you are not treating, no, in another 3 to 6 months, it will become second element. This is how the disease will progress. You clear?
Yes, sir.
Because she is having cold as a third element, I am also asking, she is having any of these symptoms like cold limbs and
Yes, sir.
abdominal heaviness, loose stools.
Yes, sir.
Yeah. So she is in between spleen chi deficiency and yang deficiency. Now it's the right time to treat her. Otherwise, she is getting to the more problem. Just start with SP9 and let me know after 1 week how she is.
Yes.
Okay. After SP9, don't treat another 2 weeks. Just follow the food itself. That's enough.
Sir, so many problem is there, sir. Cervical, back pain also. But all is controlled. Right now, eczema and menses problems there.
You no need to control anything. I'm make it disappear.
Yes, sir.
Okay. She's young. 44 means she's young. She will recover.
Yes.
Put the effort in right direction. So otherwise, you can see the same patient after 6 months with earth and water, means humidity and cold.
Yes.
Don't allow that patient to reach this stage.
Sure, sir.
Okay. Even this is how the disease progress. I think you got an idea how we are using Nadiswara for diagnosis and as well as for the treatment. Of course, Nadiswara is giving single point solution. 1 point. Okay. Yes, Ravindranath.
Hello, sir. Sir, actually, this particular Nadiswara
Your
report
voice
consistency.
switch off another.
Okay, I will go. Sir, this Nadiswara consistency.
Hello, Ravindran Nathji. Are you using more than one device? If so, please remove one. Now try to talk.
It's okay. You can text in the chat box. I can answer you. Paralysis is a yang deficiency. Don't stop your medicine immediately. You are taking medicine because you are unable to do that job. First, you strengthen your meridian, strengthen the chi, and once you feel better and better, your symptoms will disappear. Once symptoms are not there, then you can start tape down the medicine. For example, for the thyroid, you are taking 100 mg. Day one, you can't quit the medicine. We are taking medicine, but because your body is unable to do that job, that's what you're taking external support. Treat the points, maybe 1 month, 2 months, 3 months. Once you feel better and better, then reduce the dosage from 100 to 75. Then again, 2 months you treat, again 75 to 50. Like that, you should quit the medicine once you are independent of doing that job. Your body is weak, and if you are not following properly, suddenly if you take medicine, you are into problem. Okay, don't do that. Okay, thank you. If anybody is having excess heat in pregnancy, for the pregnancy, it's better to go with colors or this one, because they're all having heat means apply dark green color on the both the index finger below the nail. That will reduce body heat. For pregnant ladies, we won't treat with points. Okay. Heat, humidity, cold. Heat, humidity, cold is a yang deficiency, madam. If the second element is humid, cold or cold, humid, it's a yang deficiency. Because heat is more, there's a chances of indeficiency also. Ask 1 or 2 questions to the patients related to yin and yang. You can clarify that. For the coma patients, there is no chi much. Are you able to read Nadiswara? First, my question. First, if you are able to take Nadiswara, try. Okay.
Sir, one patient is here, is in coma. Nothing movement.
Are you able to take pulse? That is my question.
Yes, sir.
Then you send that report to me.
Okay.
Okay. Thank you. So vertigo happens with 2 reasons. One, liver heat. The second, excess blood sugar. Okay. If you are a TM students, you know how to do what to do. Do it. So I think no more questions with Nadiswara. Yes, when your pulse is not taking in the right way, the elements will vary. Don't do that mistake. Okay. Any questions which is related to humid, dry, cold? 9 to 11, avoid either hot water or cold water. So you have to treat properly with food and acupuncture points, then only you can reduce any steroids. If your early menses is there, the best point is LA11 sedation. Nadiswara right now you can use it for Android operating devices, maybe tablet or mobile. Right now it is not done for iOS. Maybe in the next version we do that. Yeah, Nadiswara which is given the acupressure points, you do it daily, same points. Okay.
Excuse me, sir. Many are confused with the acupressure point, Ayurveda acupressure, color therapy point, Sujok point, and all. So if you are giving that meditation, no, zero state of meditation, I think that will help all the participants, sir.
Yeah.
Thank you, sir.
Thank you. So I very clearly told, okay, whether you're using this point or this way or in this way, all are working. Don't get in confusion. Okay. Before doing any points, first you check the pulse. Or if you're unable to do that, take Nadiswara report. Then you decide what to do. Okay. So definitely, so we'll do a small zero state meditation so that will improve our chi energy for self-healing and to heal others. Okay. So just sit, relax, gently close your eyes. Concentrate between two eyebrows. Just feel the darkness. Now from Agna Chakra, slip into the darkness slowly and relaxedly. Stay there. Stay with nothingness. Stay there in Shunya. Stay there with nothingness and darkness. Stay there. You can create a thought to heal, to cure someone with your energy, with your thought. Stay there. Stay there. Now you are in Shunya. You can create a thought with Shunya. It has a capacity to create anything. Create a thought to heal someone, to cure someone, to bless someone. And leave the thought. Again, stay in the Shunya. Stay there. Stay there. Now, slowly come back to Agna Chakra. Between two eyebrows. You can stay there and slowly you can come back to present state. Stay there. Relax. Relax. Stay in Shunya, in zero state. Shunya means zero. Stay there and relax. Daily once or twice you can practice this. That strengthens your chi production in the body and that help you to heal yourself and to heal others. When you are in Shunya, your thought energy will get multiplied. So whatever thought you create, there's more energy to do that. So whenever you are in the state of nothingness, zero state, your thoughts are so powerful. Stay there and relax. Slowly you can come back to present state. Relax. Just imagine complete darkness, nothingness, nothing. You are into completely darkness. No imagination, no light, No breath, no chakra, nothing. You are in Shunya. The zero has capacity to create. Relax. Now you did wonders. The thought which you created with your consciousness, that will be more powerful than what you are in present state. So now onwards, you can heal anybody without touching them. And it is possible. Okay. So today we discussed about humid, dry, cold. And upcoming week, we'll discuss few more patterns. Cold, dry, humid. It is indicating kidney Qi deficiency, leading to kidney Yang deficiency. You have to reduce Yang and raise the Yin. Okay. So thank you. See you next week. Thank you.
Thank you very much, Baswara sir. Actually, this meditation brings some blissful experience. I think if you can record this meditation and set it in the group, no, that will be very helpful for us, sir. Whenever you get time, please record this meditation and send it in the group, sir. This is a request.
Thank you very much.
On behalf of all the participants for this wonderful evening, special thanks to Baswara sir. Thank you all. Good night.
Thank you, sir. Thank you so much, sir.
Thank you so much, sir.
Thank you.
Thank you so much.
Thank you, sir.
Thank you,
very
sir.
much, sir.
Thank you, sir. Thank you.
Thank you, sir.
Thank you, sir, very much. Very, very interesting.
Thanks a lot.
Thank you, sir. Thanks a lot.
Thank you,
So
sir.
at the end of the meeting, thank you
Very
all.
wonderful
Thanks a
session.
lot,
Very wonderful
sir.
meditation also.
Very wonderful. Thank you, sir.